Hi, it's Dr. Dave Morris with Magnolia Medical and MagMed TV. Today we're going to be talking about what your shoes, your good old shoes, can tell you about whether or not you may get arthritis in your knees, why you might be having a meniscus problem, why you might have arthritis in your hips or piriformis syndrome. We're going to talk today about what your shoes can tell you about that. So keep watching. All right, so we're back. So you need to pay attention to what your shoes look like, okay? Whether you're a man or a woman. Now, this will not apply to high heels with those little micro heels that you can't really tell what's happening with them because you're walking around on something the size of a pencil eraser. But for any other type of shoes, you need to pay attention to what's happening with your shoes because they can be a good indicator as to whether you may have an ankle problem or a knee problem or a hip problem, or sciatica or piriformis syndrome or a low back issue now or sometime down the road. All right, so if you look at your shoes, you can tell, is your pelvis lined up right? Are the muscles balanced from right to left and front to back in your lower extremity, meaning in your legs, right? Because if the muscles are not balanced right or your pelvis is misaligned, your shoes are going to wear unevenly, like you see here. Obviously, these are not my shoes. If I had shoes that look like this and were that uneven, that'd be a serious problem. But this person obviously has had this shoe wear much more than the other one. Now, they could actually have been born with one leg shorter than the other. Not actually all that common. What's more common is that they have an imbalance in their pelvis, or the muscles in one leg, one muscle, or many muscles are tighter or stronger on one leg than they are the other. So it causes them to walk differently, even just a little bit. Even just a slight discrepancy in how the person's gait or how they walk will cause wear and tear on their shoes. Now, we're obviously not super concerned with a pair of shoes. Now, maybe if they were a pair of, $1,000 shoes, we might be concerned with how the shoes are wearing and whether they're wearing evenly or not. But what we're concerned about is whether or not your hips and your knees are doing well, whether or not you have a meniscus problem or you're more prone to tears of ligaments. And probably even more importantly than that, whether you're prone to arthritis, because a knee replacement has about a 50% success rate. You can only do it twice in your lifetime. And then you may be looking at an amputation or something. So not on top of that, the surgeries are like $100,000. So by looking at your shoes, looking at them to see are they wearing evenly or not, you can kind of get a look into a window that will tell you whether or not things are balanced. Now, what do you do if they're not balanced? Well, see somebody who functionally can evaluate the lower half of your body. Have them look at your pelvis, make sure x-rays are taken, make sure the x-rays are analyzed the right way, make sure measurements are done. When an orthopedic looks at a pelvis on an x-ray, oftentimes he's just looking to see if there's arthritis. He's not really looking at the balance from one side to the other. He's not looking at how the bones are shaped to determine whether or not things are lined up right. So make sure that x-rays are done of your hips and pelvis to make sure that things are lined up right. Then you want to get a functional look at how your muscles are working. Is one side tighter than the other? Is the right side working the same way as the left? And if it's not, you've got to see the right person. Go to somebody who understands functional movement. Some chiropractors do, physical therapists. Some physical therapists understand functional movement. There are athletic trainers out there that understand, some of them understand functional movement, but find somebody who understands functional movement and get them to teach you how to fix these problems, because if you don't, you might say, well, it's just an $80 pair of tennis shoes. It's not just an $80 pair of tennis shoes. It's your hips, it's your pelvis, it's the nerves in your low back, it's the discs in your low back, it's your ankles. It is a lot of how you're going to get along in life. Do you want to be on a cruise ship when you're retired, or do you want to be in a retirement home, or a nursing home? So take a look at your shoes. Look to see, are they wearing evenly? If they are not, go see somebody. Thanks for watching.